SuperTalk Mississippi media production.
Ready to ride? Join us Saturday, August 2nd in Greenwood, Mississippi for the 18th annual Bikes, Blues, and Bayous, the state's largest cycling event. Fast Delta roads, blues music, and Southern hospitality await. Register now. Partially funded by the Greenwood Convention and Visitors Bureau.
This is Gerard Gibert, and thank you for listening to MidDays here on SuperTalk Mississippi.
MidDays with Gerard Gibert is on the air. MidDays with Gerard Gibert is powered by C-Spire. Power your home or business with C-Spire Fiber. To learn more, visit supertalk.fm/C-Spire. C-Spire Fiber powers SuperTalk Mississippi. Get ready to go beyond the headlines and join a meaningful conversation with people from around the state. You're listening to MidDays with Gerard Gibert here on SuperTalk Mississippi.
Good morning, everyone, and welcome to MidDays, SuperTalk Mississippi. I'm your host, Gerard Gibert, along with Rhino in the Element Wealth studio, guiding you through the middle of your day with facts, fodder, and fine music. Morning, Rhino.
Howdy, howdy.
Well, we got just a whole bunch of stuff going on. This is one of those days that I look at all the things I'd like to cover and say, yeah, we ain't getting that done in 3 hours. It's a whole bunch. So we've got stuff going on in Washington, the nation's capital. We've got stuff going on right here in the great state of Mississippi, of course. And we're going to try to get to as much of it as we can. I'm going to start with the market because the Dow had a good day yesterday, as did the other indexes. And then this morning, we started out in the red futures. We're in the red at the open. The Dow has turned positive. That's because there are some signs that the big, beautiful bill is poised to pass the United States Senate. That's after an all-nighter, it appears, a vote-a-rama. The NASDAQ, however, I'm not exactly sure why. I got to look into that. Is down. NVIDIA down. Apple up. Meta down. However, I got to share this with you. I heard an analyst early this morning, just prognosticating as they do on the future of the markets. He put a price target of $1,000 a share on Meta, the parent company of Facebook. Within 12 months, it's currently, I think, $737. $1,000.
Based on what?
Well, all the data that these guys look at is very positive. The average, the big one they look at is the average daily users. It's up. Advertising revenue up. They kind of had this investment and this effort around artificial intelligence and the tokens. You remember all that stuff? And that kind of died down. They decided, that's not our future. That's not to say that there's no artificial intelligence component to Facebook, and
they got Meta AI,
and they do. But the other thing he mentioned was
definitely not even in the top 10 of AIs you think of.
No.
I need to go to that one.
Yeah, I agree. And what's the one for Twitter? Grok or something like that? It's so.
I would say Grok's the best entry level, but
agree.
It's not all that powerful.
And honestly, the Meta AI tool it's not that visible. It's not like in your face, here, use me sort of deal.
A little circle.
Yeah, it just doesn't seem to be, I guess, as convenient.
It's more visible on a PC than it is on a smartphone. Like if you open any of the Meta apps, you've got to go to search, and then instead of instinctively tapping the search bar, you got to tap the little AI icon.
Yeah, agree. But also, they talked about Instagram, the other platforms they own, and so they're getting lots of cross-pollination from advertisers. Apparently, stuff's working. I mean, this is what the data shows in their financial statements. They're showing that they're generating a whole lot more advertising revenue. Somebody's thinking at least that, yeah, when I spend my money to promote my stuff on those platforms, it's producing sales for me. So you can't argue with that. I mean, that's borne out in their financial performers. But this is a target of 1,000 bucks a share. It's kind of amazing. Apple up right now, $4.29. That's because it looks like it may join the AI party. You've seen some announcements about possible joint ventures, collaboration, even some rumors of acquisition between Apple and OpenAI, for example, and maybe even Anthropic. Bottom line is, you got a bunch of cash like Apple does. Why do you want to invent something when you can just go acquire it? Speaking of acquiring, while I'm on this subject,
you can get it cheaper if you get them competing for. All right, whichever one of y'all could figure out how to make Siri actually work with AI, you get the golden goose.
No doubt. And although I haven't seen Apple announce anything like this, what I'm about to say, how about Meta? They're looking for AI automation architects, and they're offering, you ready for this, a bonus, a signing bonus? Now, this is a typical approach to recruiting talent in a tight labor market for certain jobs. $100 million. $100 million signing bonus. So here's what I want to say about this. First, Meta, Facebook, is a private company. They can pay whatever the heck they want to whomever they want. Government, stay out. I think this is fantastic. Second thing is, the left in this country, which is just working overtime. I sent you a couple of videos. We'll get to them. Working overtime on blasting the big beautiful bill is nothing but tax cuts for the billionaires, and I mean, it's just, that narrative is so tired. And I got into a bit of a discussion in social media yesterday with someone who is on the left and wants to return to the tax environment of the 50s. This is a myth that leftists hold in this country, that we were a lot better off when the corporate tax rate was 90%, all this kind of crap, which it never was 90%, by the way. There was a 90% highest tax rate on individuals. It's true. Nobody paid it, of course, but we've never
because the only people that would have paid it were able to actually lobby Congress for acts of Congress exempting them.
Correct. I mean, you think the tax code's riddled with loopholes today? 50 years, 70 years ago, it was ridiculous. Nobody paid it. I've read an article about this. I looked it up the other day. I wrote it in 2018 I call it the myth of the 91%. But bottom line is, they're all over this, oh, yeah, we need to increase the corporate tax rate of this, that, and the other, and the deck is stacked, and this, it's not. If you've got the skills, there's $100 million waiting for it, for you. You just need the skills. Can Facebook afford that? Yes. Would they get $100 million of value from that individual? It doesn't matter. I maintain it would, honestly, Rhino, at the way this stuff's exploding and the amount of money people are investing in this, and they're doing it because they're getting value out of it. So, how about something else related to this? I think this is also timely, given our interview yesterday with Haley Fisackerly, the president and CEO of Entergy, of course. Fermi America. This is a brand new company launched by former Governor Rick Perry and his son, Griffin Perry, the governor of Texas, I should say, Rick Perry. So they formed this company, Fermi America, and they're collaborating with Texas Tech. They're building a behind the meter, They call it a hypergrid. Would integrate the largest nuclear power complex in America, a huge combined cycle natural gas production facility, some utility grid power, solar power, and something we talked about yesterday, super innovative, novel, brand new battery energy storage to leverage the solar panels that are consuming the sun, producing electricity. If you're not consuming it right then, it's right, it fades away. But if you could store that in batteries and call it up on cloudy days, for example, there's some value in that.
Yeah, an oversimplification I heard one time is it's kind of like there's a big race course around the entire grid, whatever the grid's covering, and the power's just doing laps. But it's running out of gas if they're not pumping more into it. And eventually, it can't make it around.
Great analogy. Get this. This is 5,769 acres. 5,000 acres of power out in West Texas. 11 gigawatts of power, just for comparative purposes. Entergy's footprint in Mississippi, 3 gigawatts. This is 4 times that just on this one campus. We're coming right back in the Element Wealth studio.
Think for a moment about everything you own. The furniture, closets full of clothing, kids' toys, all that stuff in the garage. Moving to a new location, whether it's across town or across the country, can be stressful on you and on your belongings. That's why you call 2 Men in a Truck. They can move a few items from room to room, rearrange furniture, or carefully pack everything and deliver it safely to your new location. When you need friendly, reliable moving services for home or business, call 2 Men in a Truck, the movers who care. 2meninatruck.com.
For a flipping good time, come down to Cock of the Walk.
The big news is shrimp at Cock of the Walk. Try all our shrimp offerings with our new shrimp platter, combination plates with shrimp and catfish or shrimp and chicken, or put a feather in your cap with all 3 in the red feather sampler. And don't forget the greens and coleslaw, too. With locations on the Reservoir, Pocahontas, and 1 mile from the Grand Ole Opry in Nashville, Tennessee.
For a flipping good time, come down to Cock of the Walk.
I like chicken. I like fish. I like hush puppies.
I love it. Catfish is excellent.
For a flipping good time, come down to Cock of the Walk.
If you're about to start a project or remodel with wood, you need to think Miller Lumber in Richland. Since 1953, we've built a solid reputation of supplying quality wood at a lower price, like Western Red Cedar and Cypress Lumber, as well as a wide variety of patterns in pine, cedar, and cypress. Shop Miller Lumber for the best price new pine flooring and treated lumber in town. Miller Lumber, 551 Old Highway 49 South in Richland. Visit MillerLumberSales.com, 601-936-7099.
Ace Bolt and Screw is excited to announce the opening of Madison County's newest commercial industrial superstore. Ace Bolt and Screw features the brands the professionals expect to find: DeWalt, Milwaukee, Gear Wrench, Klein, Diablo, and many more. When you're looking to get the right tool to get the job done, look no further. For all your fastener and power tool needs, shop Ace Bolt and Screw. Ace Bolt and Screw, 346 Church Road, located right across from Germantown High School in Gluckstadt.
At Watkins Construction and Roofing, we're not just about repairs and replacements. With our Rooficide services, we help keep your roof looking new and free of those unsightly stains and algae for years to come. Safe, effective, and EPA approved. Rooficide is the simple solution for long-lasting roof protection. No harsh chemicals, no damage, just a clean, beautiful roof. Call Watkins Construction and Roofing today, 601-966-8233 or nomoreroofstains.com.
We've sent that Rip Van Winkle guy to the dentist.
Hey, what? Hey, what?
And what's worse than a trip to the dentist? Your wife's paint project that you've put off. Let Seabrook Paint in Jackson and Ridgeland find that Benjamin Moore paint and a contractor that will get you back doing the important things in life, like grilling and watching sports. Seabrook, Benjamin Moore Paint, and a happy wife, happy life. Seabrook Paint in Jackson on Monument and in Ridgeland on West Jackson.
First down. This is where the story of your state gets told each day. We're proud to cover the Magnolia State like nobody else. SuperTalk, Mississippi.
This segment of Middays with Gerard Gibert is brought to you by Covington County Hospital in Collins, where your health matters.
They're rolling. Middays with Gerard Gibert.
What? This is so
awesome. On SuperTalk, Mississippi.
We're back with you in the Element Well studio. So, just continuing on this fascinated me, Rhino, this report. 5,769-acre campus, 11 gigawatts of power, 18 million square feet of artificial intelligence capacity. I mean, they built this sort of purposely to host and power, should say, on this campus, data centers hosting artificial intelligence. So imagine 18 million square feet of data center capacity, all again hosting artificial intelligence technology. Well, that requires a lot of power. But you've got this power right here, and this is behind the grid, not consuming power from the grid. This is an ambitious project, no doubt about it. This ain't going to be the last of this, do you think? This won't be the last of stuff like this.
No.
I think this is kind of just getting it cranked up.
Well, I mean, if you're looking at the futurists' predictions for the near and midterm future, technology is looking at society is looking at the use of a technology with a higher use of AI.
Right.
With an implementation of quantum computing and with a look to fusion power. All of which, until you start getting into stuff that sounds sci-fi, require insane amounts of power to kickstart, jumpstart, get going, or get off the ground. So you very well may wind up with power being the bottleneck for advancement in technology. And when that happens, it's going to be a gold rush.
Yes. No doubt. So, to your point, the reports I read, the studies I read, indicate that China has built 22 next-generation nuclear plants to power their artificial intelligence industry. 10 currently under construction. In this country, fat zero, right? Zero.
Yep.
None.
I think there's technically one at a college that's for study, but it's not commercial.
Okay. I'm going to say that doesn't count.
It's not selling its power to the grid.
Right.
For the consumption of the world. It might be hooked in for net metering.
Or behind the grid to dedicated purpose. Right. So the president, you recall, declared an energy emergency. Well, I think this is part of it. I would say that's an energy emergency. If we've got our most ardent foe, and despite what Joe Biden said, yes, it's China. Remember him? Come on, man. They're not bad folks. Remember that one from the 2012? I want to say it was a 2012 debate as vice president. And I would say that China's figured it out. Yeah, we do believe that the nation which has superiority in artificial intelligence and quantum computing will dominate the world. And that requires power. And they figured that out. Here in this country, we've been busy, have we not? Or the left in this country, for sure, trying to essentially kill off the power in the country. They'd be happy if we just turned everything off. Who could forget? I know I brought this up before. Joe Biden on the campaign trail in 2020. Yes, we're going to kill the fossil fuels industry. What an idiot. Meanwhile, China says, oh boy, oh good, yes, indeed, we're all over it. And they're building. Now, I knew they had a bunch of coal-fired electrical plants under construction. But nuclear, honestly, I had no idea. 22 is what the nuclear industry is reporting, of which 10 are under construction. So I think the president's right in declaring an energy emergency, because without sufficient energy to power the future, we're going to get left behind, and we're going to be in second place to China. And we don't want that to happen. So we got to get on the stick. So I applaud Perry. I'm no Perry fan in particular, but I got to applaud him and Texas Tech in their work. Of course, Texas Tech, located in the panhandle of the great state of Texas. This will be the largest energy and data center complex of its kind in the world, by the way, once complete. Expected to be complete in 3 years. And I think you'd have to say nobody does energy better than Texas. They're the center of the energy universe. So they just announced this, by the way, a couple of days ago. It's going to be in Amarillo near the Pantex nuclear weapons plant. Amarillo, of course, just north of Lubbock in the Texas Panhandle. By the way, if you've ever been there, the wind blows all the time, and it blows hard all the time. It's unique. This is exciting news to me. I think we're going to see more of this. And bravo to these folks for taking this risk, for putting this together. Also, kudos to the president for declaring an energy emergency, because the prior guy we had did everything he could to generate less energy, unless it fit into a little thread, little needle hole, the size of a thread that met their approval, because the left in this country is pretty much insane. So the other thing going on is on the big, beautiful bill, Elon Musk, I'm going to go out on a limb here and say I don't think the president is going to be sending Musk a Christmas card this year. What do you think? He is irate about the big, beautiful bill, is Elon Musk, and he's blasting all Republicans who support Trump's, he calls it, debt-raising mega bill. He says that, what do you call it, the Porky Pig Party? Anyone who campaigned on this is Elon Musk, on the promise of reducing spending but continues to vote on the biggest debt ceiling increase in history will see their face on this poster in the primary next year. And that this is on his X account, and it's got in big, bold block letters, liar, and behind that, an image of Pinocchio with the elongated nose. He says, it is obvious with the insane spending of this bill, which increases the debt ceiling by a record $5 trillion in all caps, that we live in a one-party country, the Porky Pig Party. Time for a new political party that actually cares about the people. So he has threatened to support, through his financial means and PAC, he has threatened to support opponents, primary opponents. Also, he has announced that he will support Thomas Massie, who's received the wrath of the president, to ensure that he gets reelected. Because Massie, of course, voted against the legislation, and he's been very critical of it. In the meantime, the president, of course, he exchanges blows as well. What did he say? He's really blasting Elon Musk and basically saying he got more benefit from the subsidies, the green subsidies, than any other human in history, or something like that. Yeah, here we go. Elon Musk knew long before he so strongly endorsed me for president that I was strongly against the EV mandate. It is ridiculous, and it was always a major part of my campaign. electric cars are fine, but not everyone should be forced to own one. Amen, Mr. President. Elon may get more subsidy than any human being in history by far, and without subsidies, Elon would probably have to close up shop and head back to South Africa. No more rocket launches, satellites, or electric car production, and our country would save a fortune, in all caps. Perhaps we should have Doge take a good hard look at this. Big money to be saved. How about that? He ain't mincing any words. So it's just being announced on the Senate floor, it appears, according to Senate Majority Leader John Thune, that the GOP has a deal on the mega bill, the Dow racing even further into the green, up 447 points on that announcement. The funny money down about 1,200 today, and the NASDAQ still trending in the red. We're coming right back. We've got Leah Smith, General Counsel and Vice President for Policy and Advocacy for the Mississippi Hospital Association at 11:05. Aaron Rice, founder and CEO, American Dream Legal at 12:05.
From the Seabird.
Attention, adoring fans! It's time for
Middays with Gerard Gibert on SuperTalk, Mississippi.
I never meant to be so bad to you. One thing I said that I would never do. A look from you and I would fall from grace, and that would wipe the smile right from my face. Do you remember when we used to dance, and incidents arose from circumstance?
Welcome back, everyone. It's Middays from the Element Wealth Studio. Are you thinking about or planning for retirement? Do you have a plan? Go to myelementwealth.com or call 601-957-6006 to let Element Wealth help you find your balance between income growth and guarantees. The C Spire text line is wide open, 601-879-4395. Don't forget the Radiothon, the annual Palmer Home for Children Radiothon is going to be held next Thursday, July 10th on SuperTalk, Mississippi. This will be the 13th such radiothon every year. There are children across Mississippi that need a loving home, and many times these children are caught in unimaginable circumstances. That's why we need your help. You'll learn how Palmer Home for Children serves vulnerable children. It's a faith-based organization that doesn't take government money. That's why we need your help. We want you to tune in and join us for the 13th annual Palmer Home for Children Radiothon. That's next Thursday, July 10th on SuperTalk, Mississippi. Speaking of Mississippi, a whole bunch of new laws go into effect today because it is July 1. We're through the first half of the calendar year. What laws are those and how will they affect you? Have you taken a look at that? The first thing you'll notice is that the sales tax on groceries has decreased effective today from 7% to 5%. So that's a big old deal. The price of gas, there is an increase, 3 cents a gallon. That will occur annually for the next 3 years, terminating at 9 cents. But right now, as of today, up to 3 cents per gallon. And then we got the seafood labeling. Who would have thought we'd have had such a controversy over that? But all seafood and crawfish must now be clearly labeled as either imported or domestic. That applies to all seafood in restaurants, markets, grocery stores, even food trucks. It's the Mississippi Department of Marine Resources and the Mississippi Department of Agriculture and Commerce who will jointly manage these labeling requirements. That was House Bill 602 signed into law this past session. And then, something I I haven't mentioned, whenever we've done a rundown of the legislative accomplishments of the years, the anti-DEI bill that finally did pass. And this law eliminates such DEI practices from public schools, colleges, and universities. It mandates that educational and employment opportunities are merit-based and based on qualifications without any checking of boxes and consideration of all these other characteristics and trying to achieve some sort of diversity quotas, which are misguided. Now, of course, no surprise, the American Civil Liberties Union, which is, for the most part, a bigoted organization. Am I being too harsh there and hostile, Rhino? You're shaking your head no. I don't think so either. They filed a lawsuit. We should not be surprised. Where's the Southern Poverty Law Center? Surely they're going to file one, or maybe they're going to join in with the ACLU as a plaintiff. So the state is seeking to have this lawsuit dismissed. Please explain to me why anyone would object to limiting consideration of qualifications and merit, limiting to just that, I should say, as part of an employment process in selecting a candidate. Honestly, and this is only in the public sector, by the way. This doesn't apply to the private sector. The government's not stepping in there. You know, if a private company wants to utilize those characteristics, those factors in hiring, promoting, terminating, I'm cool with that. I think it's dumb, but I don't want the government to dictate to companies such. I believe that those policies are effectively racist in nature and discriminatory at a minimum, because it could apply to more than just race, of course, in these diversity metrics. A new law makes impersonating a police officer a felony in Mississippi. Gee, what was it before this law passed? Was it like a misdemeanor or something, or a minor offense for impersonating a police officer? Isn't that just how the former Speaker of the House of Minnesota was assassinated? This dude showed up. Is it Minnesota? This dude showed up with the uniform on and disguising himself as a police officer.
Yeah, it was Minnesota Speaker.
Yeah, that's what I thought. And assassinated both she and her husband. So you could face up to 3 years in prison and be fined $5,000. This is a big one that I think is going to be somewhat controversial. Camping on public property makes it illegal to camp on public property unless it's been designated for that purpose by government. So this law instructs law enforcement to provide individuals with a 24-hour notice. If they leave stuff after that, unless considered tied to a crime, law enforcement can just discard it, throw it away. $50 fine for not complying. And it's designed to address blight. And then this one came up as well. I remember talking about this during the session. The panhandling permit requires a person who solicits or panhandles near roads to have a permit, $25, and they have to apply for a new permit each day. Wow, they solicit. So that would seem to suggest, wouldn't you think, Rhino, that we're going to see all these panhandlers disappear? They're all around town. They're all around the state, not just in the central Mississippi metro area here. So it's deemed as a misdemeanor crime of forgery of a solicitation permit if you don't get a permit or you have a fake one. $300 fine and possible jail time. And there have been some cities which have pushed back and said, yeah, we don't have the resources. You've seen this, to enforce this. Jackson and Capitol Police said they're not prepared to enforce the anti-homeless bills and the panhandling crime. Not surprised. that they would say that. We'll see what happens when newly elected Mayor John Horn takes over. Might be singing a different tune, right? But I guess the thing that certainly will impact us all today is if you go to the grocery store, certain items you purchase will only be taxed for sales tax purposes at 5% as opposed to 7%, and then 3 cents per gallon more tacked on to the price of gas, which goes to the Department of Transportation. All that in effect today. Interesting. The big, beautiful bill, while it's being debated, you probably heard on our news little story about the Justice Department busting a $14.6 billion health care fraud. Involves 324 individuals, 96 of which are medical professionals. Now, I've pointed out on the show, and you've never disagreed with me, that the fraud that occurs that is paid by Medicaid, Medicare, government insurance, it's not just the individuals who are enrolled in those programs. There are health care providers across the spectrum that have been committing this fraud as well. They're not honest actors either. This particular investigation led to a bust of 96. Everything from pill mills to just dual billing of Medicare and Medicaid and illegitimate billing, getting old people to sign up for stuff they don't need, don't know anything about it, so they can go bill. And then they're also using credentials of patients and then fabricating authorization or approval of certain purchases and submitting those claims to the government and putting the money in their pocket without providing the services. That's what happens when you got big government programs. You get big fraud, waste, and abuse. And this is $14.6 billion. The Centers for Medicare and Medicaid Services also said that as a result of this investigation, they put measures in place that have prevented more than $4 billion being paid in response to false and fraudulent claims. It is also revoked the billing privileges of 205 providers in the months leading up to the bust. Man, coming right back.
Hey, this is Bob.
Come on. Middays with Gerard Gibert.
All right, we are back
on SuperTalk, Mississippi.
Welcome back, everyone. It's Middays. We're coming at you from the Element Well studio. So, Senator Leah Smith from the great state of Michigan, not a big fan of the big, beautiful bill, it's fair to say. And, you know, we've been talking quite a bit about how it seems like the central theme of the objection by Democrats to the bill is the changes, the health care reforms. So listen to what Senator Slotkin says.
I did a little math. If you're a family of 4 in Lansing, Michigan, making a total of $129,000 total, and you're on the Obamacare ACA marketplace, your bill will go up by $5,500 next year. That's a 52% increase in your health care bills. If you are Joe and Nancy from Lansing, Michigan, 60 years old, your kids are out of the house, they're grown, you make $82,000 a year total between the two of you, your health care costs, if you're on the marketplace, will go up by $13,000. That is 197% increase in your health care bills. So what are Joe and Nancy going to do? Are you going to pay for health care if it goes up by 197%? Think of your own health care. No. Joe and Nancy are going to be at risk for being off health care. And the combined cuts between Medicaid and Obamacare and the price of everyone else's insurance going up, we believe that enough people are going to be kicked off that it's going to feel really close to 2010, when the number one cause for bankruptcy in the United States of America was medical debt because people don't have insurance.
So, I've often talked about how these politicians take advantage. That's a bunch of numbers and figures in that discussion, right? And most people just glaze over. And they take advantage of the fact that most people really don't know what she's talking about, except they did key in on, wow, my insurance is going up $7,000 or whatever it was, the first example.
I think it was $13,000.
Okay. So I think that's right. It's a family of four example. She did a family of four, then a couple, then an individual. So, but it lacks context, as the left likes to say. And I'm going to explain it to you. First, you hear those numbers like, where did she come up with that figure? Like I don't remember the exact, like 129,000 or something like that for the family of four. And that kind of triggered a little memory in my head and started doing the research on this yesterday. So here's the explanation. That happens to be exactly 400% of the federal poverty level. Why is that important? Because the way the subsidies are structured in the ACA marketplaces, the so-called Obamacare exchanges, where you can buy coverage and receive a subsidy from the government to pay for it, and it's calculated to limit your out-of-pocket premium cost to a percentage of your income, starting at 100% of the federal poverty level up to 400%. But if you make $1 more than 400%, you lose the subsidy. That's known as the subsidy cliff, is what it's referred to. This is a bit timely because we got Leah coming in from the Mississippi Hospital Association next. But what she's saying is that Joe Biden's Inflation Reduction Act and then the American Rescue Plan, actually I got them reversed. The American Rescue Plan and then the Inflation Reduction Act, both pieces of legislation that passed early on in the Biden term, they reformed the way the subsidy cliff works. Basically said you can keep buying insurance on the exchanges even if your income is above 400% of the federal poverty level, and we will still limit the premiums to whatever it is, I think 9.5% of your household income. That's what she's talking about. Now, here's the important point. All that expires, by the way. In those two bills, it was passed in the American Rescue Plan, and then it was extended in the Inflation Reduction Act. That's scheduled to expire at the end of this year. Why? Because it passed with the simple majority instead of the supermajority, the filibuster-proof 60 votes in the Senate, and it had to limit it to pass under Elizabeth McDonough, the parliamentarian's rules. Here's the deal. All we're doing here by allowing it to expire, Rhino, is returning to the original Obamacare policies. So now are you saying, Senator Slotkin and your Democrat colleagues, that Obamacare had bad provisions in it?
Sure seems like it.
What a hypocrite. You think she's going to explain this as I just did to the people?
No.
Not no, but hell no. I'm not even sure she can, because if you watch the video, she's reading from a piece of paper that her staff gave her, right?
Yep.
She has no idea. She's just spouting numbers off. No idea the underlying reasons for why that's going to occur. So we're simply returning to Obama-era Obamacare, and they're mad about it. Fox News, SuperTalk News next, then Leah Smith. Stay with us. Hour of Middays with Gerard Gibert is brought to you by the Mississippi Business Journal. Visit msbusinessjournal.com. Scott Coopwood, publisher and president.
And now, the talk that keeps Mississippi talking.
That's what I like to listen to.
You're listening to Middays with Gerard Gibert here on SuperTalk, Mississippi.
Welcome back, everyone. It's hour 2 of Middays, live from the Element Wealth studio. Just watching on the screen here in the studio. Looks like the Senate is getting sort of configured there, Rhino, to take a vote, pass the bill. Now, what happens after that when it goes to conference? Who knows at this point? But we're pleased to welcome now Leah Smith, General Counsel and Vice President for Policy and Advocacy for the Mississippi Hospital Association. Hey, Leah, thanks for coming in.
Good morning. I'm so glad to be here.
All right, so we're glad to have you. So a lot of provisions in the big, beautiful bill, all 940 pages of it. It did shrink when it came from the House. It was over 1,000 pages. It's now below the 1,000-page mark. But much of the provisions of this bill, outside of all the various tax language, concern health care. That's something that affects your members, the members of the Mississippi Hospital Association, the hospitals not only in Mississippi, but, of course, across the country. So I'm sure your members, your organization, you're watching this closely, and there's some things you guys are concerned about.
We do have some concerns, and we've been talking to the delegation. And look, I just want to start by saying they've been great. This is my first year on federal advocacy with the Hospital Association, and the number one thing I want to say is our staffers up in D.C. are amazing. They're polite, and they do all the right things in that regard, but they're also so knowledgeable. And so we've been back and forth and talking to them, and there have been things that have changed in the bill, even in the Senate, from the Senate Finance Committee language that was really problematic, that have changed since then because of our advice and because of our conversations. So I think the first thing we would want to say is just thank you.
Okay.
Beyond that, we have some different concerns. The bill, really does impact expansion states more. So you've got some
Medicaid expansion.
That's right.
Of which we're not one. There are 10 that have not expanded. We're one that hasn't.
That's right. So those states that have expanded for able-bodied adults, those are the ones that are going to see some real big pinches. But we have some too. And top of the list is our state-directed payment program. So the way that the bill reads currently, which it is changing, I think the parliamentarian right now is looking at handwritten changes. So
it just passed, by the way, in the Senate. It literally just announced.
It did?
What was as drafted just announced.
Okay.
Yeah.
Well,
literally just happened while we're sitting here. I'm watching on the screen.
Well, I'm very hopeful that we're going to be talking about the right provisions because we don't really know. But that being said, what was in the bill about a half an hour ago when I read it?
Okay.
Was some provisions that would take our state-directed payment program rate down from the average commercial rate to 110% of the Medicare rate starting in 2028. That's better than the Senate Finance Committee language, which started that step down in 2027. It's not as good as the House language, which would have grandfathered in our average commercial rate. And just to give you some context, when the state-directed payment program, the MHAP program, really started in 2015, we were pulling in about $500 million out of that program. And when it blew up in 2023, many thanks to Governor Reeves, who instructed the division to look at some new studies and piggyback off of some things going on in Louisiana.
And Florida.
Yep. Blew up that program. We're now pulling in $1.5 billion because of the average, commercial rate. So it's a big deal.
Yeah.
And stepping back down to Medicare is going to mean hundreds of millions of dollars in losses.
Yeah, so just I'll attempt to explain it. Correct me if I don't get this right. But essentially, you got three major payers. Right. Commercial insurance, Medicare, Medicaid, and they don't all pay the same rates for the same services.
That's right.
In general, in that order, commercial pays more than Medicare, which pays more than Medicaid, and many providers, including hospitals, say we actually lose money every time we provide services that are claimed under Medicaid, reimbursed under Medicaid.
That's exactly
below cost.
That's exactly right. And so for years, we were under reimbursed
for
many, many patients. And so what happened in 2023 was really kind of a truing catching up of even what we had been under reimbursed in the past. And since then, again, thanks to Governor Reeves, we've been able to do things like open service lines, keep the doors open, hire a doctor, or do all of those sorts of things. So stepping back down to 110% of the Medicare rate, which is what we would be at because we're a non-expansion state.
Right.
Expansion states would be at 100% of the Medicare rate, is really going to hurt. We do get a runway, which hospitals like. We like to know when things are going to happen. So at least we know we've got until 2028, and then we start stepping down. But it is going to mean hundreds of millions of dollars gone when we are up to $600 million a year in uncompensated care. We've climbed back up to $600 million.
Yeah, I didn't know that. It wasn't too long ago. It seemed like it was 400.
It is climbing, and it just continues to go that way.
Okay, so now let's explain this to the folks. Hospitals do receive some money from the federal government. It's called disproportionate share.
That's right.
Shorthand for it is DISH payments, is how it's referred to in the industry. And basically, it's when the federal government looks at your patient balance, your payer mix or non-payer mix, and they'll send you some money because you have an outsized amount of Medicare, Medicaid, or uninsured relative to commercial, right?
That's right.
Did I explain that correctly?
You're absolutely correct. And we get about $30-40 million from that. We will lose that beginning this year.
Okay.
Those will be a step down. There'll be a big reduction there. The House language actually included some provisions that stepped that back to beginning in 2028, so we would have gotten a little more reprieve.
Okay.
So that's another smaller financial hit, is that DISH will begin to go away in September.
All right, so state-directed payments and then DISH payments possibly cut some holes in reimbursement to hospitals, your members. Let's talk about the changes in the provider tax and how that might affect Mississippi.
So less concerning.
Yeah.
And we are grateful for what the Senate did, which is grandfather in our rate.
Right.
So there's a 6% safe harbor in federal law. So federal law already dictates and puts limits on provider taxes. That limit is at 6%. We are about, couple tenths of a percentage point away from 6%, so we are almost to the limit.
Okay.
I think there are some questions about that language and the CMS regs and what will happen if we want to restructure that, for example. And we might need to restructure some things depending on what happens with this big, beautiful bill. We might need to change up some things, and hospitals are very used to that. But so we don't know exactly how that's going to be implemented, but we are very grateful for the grandfather clause. Non-expansion states, not non-expansion states, will see the beginning of a reduction.
They got
in that.
a problem.
They've got a problem.
No doubt.
0.5% to 3.5% is where they end. So they're kind of getting hit from all sides.
Yeah. And so let's just explain this to the audience that might not be familiar with provider taxes. These are just taxes levied at the state level on healthcare providers. The state collects money from them, essentially, which gives states then more money to tap more federal Medicaid dollars.
Correct.
And so what the federal government's saying is, you guys are kind of gaming this thing here. You're getting money from the private sector to take more money from the federal government. And they're saying they're putting an end to that. Not an end to it, but they're restricting it somewhat and reducing it.
It's been interesting. I mean, we've heard terms like gimmick and scheme and things like that. I mean, I think the way we view it is we have voluntarily chosen to be taxed.
Yeah.
So that way the money does not come from the general fund. That way, that money that would have otherwise come from the general fund can go to fund other things in Mississippi that need to be funded. Hospitals are willing to tax themselves to the tune of about $475 million in order to pull down federal money that frankly, accounts for uncompensated care that we're required to provide.
Yeah.
I mean, that's part of the problem. I know you're a free market guy. I like the free market too, and we just don't exist in that.
I know. I mean, I agree with that.
I know. I've heard you talk about it before, but with EMTALA, we are required to screen and treat any patient that comes through to our ER, and that costs money. And a lot of Mississippians, a lot of working Mississippians, don't have insurance. I talked to a hospital CEO not too long ago who saw 11. He used these stats. He saw 11 people come through the ER. 9 of them were working. And there were people working in his community. It was Louisville, actually, a small community. So, I mean, he knows these people. He knows that they have jobs and they're, just trying to make ends meet and they don't have insurance. And he's got to screen and treat them. And he wants to screen and treat them.
Sure.
Because there are people that go to church with him and shop at the grocery store and whatever else. So.
And many workers in Mississippi, we don't have a lot of large companies that typically offer health insurance as part of their compensation and their employment package. There's lots of small, mid-sized businesses that find it cost prohibitive.
That's right.
And just don't offer it. So they're on their own, essentially. So they're working, but they don't have access to commercial insurance through their employer.
That's right.
Which is where most people in this country get their insurance.
That's right. I've never experienced not having insurance. I can't imagine how taxing that would be on a family, and it's draining hospitals. I mean, it really is. It's a very difficult situation that we're in.
Yeah, it is.
Which is part of the reason why the exchange has been so important.
Yeah, we'll get to that in the next segment. We've got Leah Smith, General Counsel and Vice President for Policy and Advocacy for the Mississippi Hospital Association in the Element Well studio. We're coming right back.
From the Seabrook Paint.
And now, the talk that keeps Mississippi talking.
Now, on to the real part.
Dynamite! On SuperTalk, Mississippi.
The Queen of Soul bumping us into this segment here, the great Aretha Franklin. Leah Smith, General Counsel, Vice President for Policy and Advocacy for the Mississippi Hospital Association, is our guest in the Element Well studio. So the House leadership just announced after the Senate, we just learned, passed a big, beautiful bill. Rhino, you told us there were 3 nays. Collins, Paul, and Johnson? Is that right? Oh, Tillis, right. Pardon me. Johnson, he came around. How could I forget Tillis? Because he's been all over the news having opposed the legislation, and the president lit into him, and then he said, okay, I'm not running again.
That's right.
So
that's right.
He kind of solved that problem. All right, but we're just looking at now the announcement coming from the House side, Leah, is that we think we got a deal that they can get through. That's what House leadership, that was just put up on the screen here. So
I'll tell you what, this is my first time on SuperTalk, and I came at the exact wrong time because the bill is changing like every 5 minutes. So
I know, and you and I were talking
working
about
with it.
I know, but this something that's important in Mississippi is a rural hospital stabilization fund. Explain that. We're not sure where that landed right now. There was a difference in the House and the Senate version. There was some discussion about that. I'm not sure if the parliamentarian had to get involved in that one or not.
So
but talk about that.
I would love to, and I'll talk about the parliamentarian separately. That's been so interesting to learn about the bird rule and the bird bath and all of that sort of stuff. But with this rural hospital transformation fund, we were so glad to see it included. It's so important for a state like Mississippi that pretty much all of our hospitals are considered rural in one way or another, and will benefit. Many of them will benefit from this fund. The major problem with it. The House, I think, recommended $15 billion. The Senate landed on $25 billion when they got through the Senate Finance Committee. I had read 30 minutes ago that in an effort to appease Senator Collins, they were moving to $50 billion. Now, maybe that didn't get through, and that's where the no vote came from. So I'm not really sure. But the major issue is it's a one-off program. So, I mean, the way that it's going to work under the $25 billion scenario is it's $10 billion in 2028, $10 billion in 2029, $2 billion the next 2 years and then $1 billion, and then it's gone. And I think that this is something that our CEO, Richard Robertson, has talked about with you before, but one of the challenges, like any business, is you have to be able to plan.
Sure.
And I think hospitals keep getting the rules changed. There's a new program, there's an old the program's going away, the program's coming online in 5 years. There's no way to hire a doctor and say, all right, we're going to keep you for 4 years, and then in 2032 or whatever, we're going to have to let you go.
Yeah.
I mean, that's not a good business practice. And so I think what we have tried to advocate for is pick a program and let's just stay with it. Let's just stay with whatever we're going to do, and that way we know what we need to budget for. And the off-ramps are helpful. Knowing these extended time frames are helpful, but we have to be able to plan, and that just hasn't been that has not been in the cards for hospitals across the nation, really, but Mississippi.
The House proposed $15 billion.
Okay.
The Senate amended that to $25 over 5 years.
That's right.
Susan Collins, who, Rhino, you just informed us was a nay vote, she wanted $100 billion.
Okay.
Is what she wanted. So I'm thinking that maybe she opposed the bill because it didn't get to the $100 billion that she wanted.
I think that's probably true.
Yeah.
I did read a stat this morning from the National Rural Health Association. I've not vetted it, but it said that we're only going to make up 43% of what rural hospitals are going to lose under the bill in Mississippi with the $25 billion. So, with the state-directed payment losses, with the DISH payment losses, with the health insurance exchange issues.
Let's talk about that. Keep going, but let's just get to that.
Yeah, I just, all of those things collectively are going to be a really big hit over time.
Okay.
And that's the issue. But look, grateful for it. Glad it made it in there. The conversations really started about a week ago. We've been sending correspondence almost daily to staffers and our senators, and we got word that there might be a fund, and we were very grateful for it. So we're glad it's in there.
So how do the hospitals tap that fund? How do they qualify for that? What's the process? I'm sure it's arduous at best.
Well, it probably is, and that was one of our concerns, is that many of these sort of one-off programs have a lot of hitches, and we're just going to have to see how that shakes down in regulations. I do know the way that it's going to be allocated is half is going to be allocated to the states just equally, and then half is going to be based on CMS discretion. We are not big fans of that. We would like for Congress to say what's rule, so that way we know that Mississippi is going to be included, because how could almost all of our hospitals not be included?
Right.
And so we would prefer not to give that to the agency discretion, but right now half the fund is left to the agency. So we don't know details other than that.
Okay. So we were talking about EMTALA. Of course, I always remind the audience this was passed and signed into law by Ronald Reagan. A lot of people don't realize that.
Right.
The Emergency Medical and Labor Treatment Act. I think I got it right.
Yeah,
the acronym. Bottom line is, if you show up at the ER and there's some sort of urgent medical condition, or you're in labor, the hospital is required to stabilize the patient, essentially,
and transfer them or do whatever they need to do.
Yeah, and back in the old days, I've researched this extensively. They dump them on the public county hospitals, where the care, honestly, was subpar.
Right.
But they'd get them out of the better private hospitals. And that's a requirement if they, I believe, participate in Medicare, if I'm not mistaken.
That's correct.
So to stay in the program. So it's the only industry I know of where you're required to deliver services to someone even if they can't pay.
That's right.
There's really none other. So on that basis, I've said it many times on the show, we really don't have a free market in healthcare until an ER could say, oh, can you pay? Well, if you can't pay, I'm sorry, we can't take care of you.
That's right.
That doesn't happen in this country. Doesn't happen in Mississippi.
That's exactly right. And I would say I've worked with the hospitals for 5 or 6 years in my previous role with the lieutenant governor, but I've worked with them so much more closely, and I can definitively say they want to care for people.
Sure.
I mean, it's not as if when people walk into an ER, they want to leave them desolate. They want to help them. They also want to keep the hospital open. and they want to keep service lines that are needed in the community open, and they want to recruit a new physician to care for more. They want to do all these things. So it is. It's very difficult, and it is not a free market, and that's why things like CON still exist, which we might talk about later, but and will likely come up again next year, and we're in favor of reform. But in order to get rid of things like that, we also have to exist in a true free market, because otherwise we don't have the payer mix that supports keeping a business open that's underwater.
I understand.
And in 2023, we really saw a situation. I mean, I was actually on the campaign trail in 2023. So imagine being on the campaign trail and having to answer questions about hospitals that are failing. You know, thank goodness that was remedied in the fall with enhanced MHAP, and that's all good. But on the campaign trail, it was hard to answer those questions. You know, how are we going to save the hospital in my community? And hospitals are changing. I have been so impressed with how open our hospitals are to talking about their business models, or how they can work together, or how we can share information and reduce costs. But we're the lowest cost in the nation. I mean, that is the truth. We are the lowest cost in the nation, and we're about mid-range related to care. So we are providing excellent care at a very low cost. It's a revenue issue.
And so the reason I brought this EMTALA issue up, and you did a great job of expanding on that, was because of what you pointed out earlier in our discussion, that just a large number of uninsured
That's right.
In our population. And it's likely that number is going to be boosted with these reforms that are coming out of the bill. One of those reforms that would affect Mississippi, of course, is that the enhanced subsidies in the ACA marketplaces, the exchanges, those expire at the end of this year. I just researched this a couple of weeks ago. I was a little shocked to learn that the ACA enrollment in Mississippi, just as it has across the country, is increased substantially to like over 300,000.
Yes.
330,000, I think, is the last figure I saw, of which 270,000 received some sort of credits, of subsidies from the federal government for that coverage. But it is expected that many will drop their coverage because they'll have to come out of pocket with more when the enhanced subsidies are terminated or expired at the end of the year. And that could, again, bolster our uninsured population, which could be a problem for hospitals, could it not?
Absolutely. It's a huge problem. I mean, you know, they're not going to be able to pay. And if they have the insurance, it's junk insurance because they can't afford the out-of-pocket cost.
We got a break right now. If you can hang around, we'll continue this discussion.
Happy to.
All right. We got Leah Smith, General Counsel, Vice President for Policy and Advocacy with the Mississippi Hospital Association.
Middays with Gerard Gibert. It is on SuperTalk, Mississippi.
Back, everyone. It's Middays from the Element Wealth Studio. So we went to break, Leah. We were just talking about how we might see the roles of uninsured shrink from losing the enhanced subsidies in the Affordable Care Act. Now, the latest estimates by the CBO are that some 12 million or so are going to lose coverage from all the various reforms, Medicaid, Medicare, and, of course, the ACA exchanges. But Mississippi, you know, there was a time period where kind of 100,000 was sort of the average per year. But with the enhanced subsidies, and I think more insurers participating in our exchanges, and probably more importantly, and let you talk about this, more providers are now in network and accepting, right, the coverage sold on the exchanges. For a while, you could get coverage, but you had to pay out of pocket before you left the doctor's office or the hospital or have some other arrangement and then get reimbursed.
It was essentially junk insurance.
Yeah, it was terrible.
And so providers didn't want to participate.
Well, that's improved a lot.
It is totally improved, and I think the pandemic really had a huge impact in that. I mean, not only did the subsidies occur because of the pandemic, but also I think people got really interested in their health care.
Yeah.
And they got interested in the ways that they could pay for their health care. And this came along. I think government started paying attention to the exchange.
Right. Yep.
That's why we saw so much talk of it in 2024 when we were going through some of the Medicaid expansion debates. I mean, the exchange was a huge part of that. The subsidies were a huge part of that. So I think letting it go is going to be hard on Mississippians. It's going to be hard on hospitals.
24 million nationally enrolled, last I checked at KFF, in the exchanges. Wasn't too long ago, it was 10 million.
That's right. That's
like
right.
7-8 years ago, it was 10 million.
Which I think is shows that people want to take care of their health care. None of us want to go to the doctor and not be able to afford it. Yeah. I mean, I've talked to people who have been either on Medicaid and kind of been looked at a different way, or have not been able to pay for their health care. And it's an embarrassing, I mean, it's a thing that you don't want to happen to you when you're trying to take care of things in your life. So I do think that there are working people in Mississippi that want to find a way, even if they're cost sharing, even if the cost sharing goes up a little bit.
Which is planned in the bill, right? For Medicaid.
That's right, for Medicaid. But, on the subsidies, I'm wondering if there would be room for, taking down, for example, you were talking about 400% of the federal poverty level. That may be too high. Yeah. That may be too high for subsidies. Maybe we take that down a little bit. Maybe we increase cost sharing a little bit. But to just do away with them, I think would be really problematic, not only for hospitals, but for patients.
Yeah, and that's something else, the cost-sharing subsidies that, the president has sought to reduce. And then what happened is all the insurers sort of restructured their plans around that so that there would be less out-of-pocket costs, right?
That's right.
So they could get premium reimbursement.
That's right.
Yeah.
So it's a big change. It's a big change.
All right, so what are hospitals doing? I mean, you represent the Hospital Association. What are you guys doing to kind of prepare for all these changes? Because it's a lot, as we've talked about here.
It is a lot. I think that we are going to have to see what ultimately passes, which looks like it could be fairly quickly here, which surprises me, actually. I thought there would be more maybe debate in the House. It's going to take some time, maybe a year, to roll out CMS regulations on all of these things.
Got to code it.
So we're going to have to, that's exactly right. So we're going to have to figure out, what that means, for example, in terms of our provider tax. Can we restructure? Yeah. Are there things we can do even within that limit that we're going to be grandfathered in at? And then our hospitals are very aware, even with the state-directed payment program enhancement that happened in 2023. Yeah. They were very aware that could go away at any moment. So they have.
But isn't it? I don't mean to interrupt you, Leah, but isn't it fair to say that maybe some hospitals, particularly our rural hospitals, were on the edge and may not have survived without that?
100%. I mean, we had 3 or 4, and this is just from knowing health policy, being on the campaign and not being with MHA. There were 3 or 4 hospitals that were on the brink of shutting down. Even our larger systems were struggling. Service lines were closing. We had other big issues like Greenwood and places like that that were really struggling, and they were really helped out by the enhanced MHAP. So and they're doing fine. Hospitals are doing okay right now in Mississippi. Okay. And they're adding where they need to. They're adding a service line. They're partnering together. I just saw not too long ago that Tyler Holmes, for example, has partnered with Baptist to add cardiovascular services. Okay. So that is one thing they're doing. They're figuring out how to cut costs, how to work together to provide services, share workforce, share information. That has been a really big thing at MHA. We are trying to figure out how to leverage AI, health information, so that we can be efficient in transfers, for example. Okay. So that we can identify, for example, patients who are going to the ER more than 4 times a year and redirect them somewhere else, so that they are getting general health care and they're not showing up in the ER for a flu situation. Sure. And we can do all of these things with technology. We're building a lot of that out. But I think that hospitals have always known that the average commercial rate was fragile, that it could go away. And I think for that reason, they have planned accordingly. They haven't been spending, or acquiring or trying to add where they might have to completely cut in a couple of years. But still, it's a blow, and it's going to be hard on hospitals.
What are you going to be talking to the legislature about this coming session?
So, I think the payer mix is always at issue. There might be some other creative ways we could deal with that. And I've had some broad conversations with Chairman Creekmore about this and Chairman Bryan. I think that CON is back on the table. I think we'll probably see a bill kind of like what was vetoed this year because of the one issue with one hospital. We would like to see that bill go a little bit further. We liked the House version that allowed hospitals to do things like dialysis. If we are going to require hospitals to see and treat patients that can't pay, we should also allow hospitals to perform services that typically do pay. And not only that, but it's good for patients to have a choice. If they want to stay in their hospital with their other providers to receive that treatment, then they should be allowed to do that. And right now, they can't.
So what's the official position of MHA on CON reform in general? I mean, are you for complete repeal of all CON or limited? Tell us about that.
So with the payer mix issues, we feel like CONs need to remain intact in some form because we don't have the benefit of having all patients that pay.
Okay.
But having said that, we believe in reforms, and we worked closely with Chairman Creekmore and Chairman Bryan on that bill. We worked closely with Kevin Blackwell. For example, the CapEx expenditure thresholds are too low.
Yeah.
I mean, right now it's $1.5 million on equipment
to pave a parking lot. That's ridiculous.
Or buy a piece of healthcare
equipment.
We have far exceeded $1.5 million.
Sure.
We should have had a growth rate in there. We do to some extent, but it has been applied in sort of a wonky way. And so we believe that we need to raise that and add a growth rate for clinical, non-clinical, and for medical equipment. We are fully on board. We also believe in a level playing field.
Okay.
So everybody needs to play by the same rules, and right now we don't necessarily.
Okay, so the House bill you guys were in support of. That came out this year.
We in fact liked the original version of the House bill that kind of went a little bit further.
Further reform, yeah,
yep.
Exactly.
Yep.
Well, that's going to be a big topic again in this session.
I think it will. Talk to Chairman Creekmore about it the other day.
And perhaps it will include even additional reform as well.
You never know.
Okay. But your members are okay with that.
We are always willing to look at reform. We know that things don't need to remain stagnant.
Well, a whole lot of folks in white coats show up, as you know, in those committee meetings that oppose it.
You would be surprised. I mean, we really didn't have a lot of opposition to the bill that was at issue this year.
Okay.
And I think that's just because we all worked it out and talked about it in advance, and we knew that there wasn't going to be wholesale repeal because we're still dealing with that payer mix issue. And we know that
we'll work on that.
It might be on the table at some point.
But Senator Bryan doesn't seem to be in favor of anything.
You know what? He was fully in favor of the bill that he and Sam Creekmore negotiated together.
Yeah.
And he was great about it. I think he understands that. I'm not going to speak for him, but I think we all understand that a threshold of $1.5 million, for example, on medical equipment is going to change over time.
That's a no-brainer.
It has to.
Yeah,
that's right.
That's an easy one, though.
That's right.
But I think we can go further than that. Don't you?
We will definitely be working on it.
We'll keep talking about that. I appreciate you coming in, Leah. Enjoyed it. Thank you a lot.
Me too.
Yeah. Leah Smith, General Counsel and Vice President for Policy and Advocacy for the Mississippi Hospital Association. She's been our guest in the Element Well studio, another segment in this hour. And then in the afternoon portion of Middays, it's Aaron Rice, founder and CEO of American Dream Legal.
When the clock strikes 12, we'll cool off and start rocking around the clock again. We're gonna rock around the clock tonight. We're gonna rock till broad daylight. We're gonna rock around the clock tonight.
belly up of Mississippi.
You know what that means.
Middays with Gerard Gibert.
We'll do it live.
On SuperTalk, Mississippi.
Welcome back, everyone. It's Middays. Thanks so much for joining us. Hope you enjoyed that discussion with Leah Smith, General Counsel, VP for Policy for the Mississippi Hospital Association. And again, besides the tax provisions, Rhino, the vast majority of this bill deals with health care. But as we said before, when you look at the money that goes out the door at both the federal and state level, we're in the dadgum health care insurance business, are we not? Between Medicare, Medicaid, TRICARE, and all the ACA subsidies. I mean, it's a ton of money involved in that. As we've talked about before here in the state of Mississippi, just a reminder, the Medicaid program, combined federal and state monies, larger than the general fund budget. It's incredible. $8 billion a year. General fund budget, $7 billion. The one just passed, just enacted in the special session. So $1 billion more than the entire general fund goes into the Medicaid program in Mississippi. Was it, who were we interviewing that informed us? May have been Richard Roberson that was talking about like 70% of the reimbursement for health care services in Mississippi comes from one of the government programs. I think that's right. Between Medicare, Medicaid, TRICARE, ACA subsidies. Man, so the ACA subsidies deal, somebody asked a question, where is it? If you're making $129K, it would be on Obamacare. So it used to again, $129K would be for a family of four. And the way, again, the subsidies are computed, they're based on the percentage, a limitation of premiums to a percentage of your income, 8.5%. So you can see how with a family of four at $129,000, the cost of health insurance for a family of four annually is a lot more than 8.5% of $129,000 in general. I say a lot more. Maybe not so much in this state, but in other states. Heck, in New Jersey, I think last I checked, it's like $30,000 a year for health insurance for a family of four.
Probably less before Obamacare, though.
Oh, there's no doubt. I mean, I know you brought that up. You made that very clear. But you're looking at, what, $10,000 a year for a family of four? It's not out of line for the state of Mississippi. So you can, at 8.5%. So you can see where subsidies would come into play. I haven't checked it lately because I don't have a family of four, but my guess is family premiums these days, family of four, average on average for commercial coverage through your employer at Mississippi, probably $1,200 a month. Because, an individual's, what, $800-900? So $1,200-1,500? Now, if you're in the exchanges, that means you don't have coverage from your employer. You're self-employed. We have a lot of people that way. You work for a small company that doesn't offer coverage, not mandated to do so by the federal government. Only 50 employees and up are. We have a lot of companies in Mississippi, across the country, that have fewer than 50 employees. They're not required to provide insurance coverage to their employees. So the option is they go buy in the individual market through the ACA exchanges. Well, heck, you go buy coverage for a family of four, it's probably in the $18,000-20,000 range these days in the state of Mississippi. So that's considerably more than 8.5% of the $129K. So that's That's just the answer to the question, why would you be on Obamacare? It's just how it works. Stewart Landscape says, my last quote from Blue Cross was $450 per person in a household. Family of 6 here, that's $2,700. I assume you mean per month, right? So, got to. So, $2,700 per month. You see where that puts you. That's what, $31,000 a year? $32,000 a year? It's incredible. Incredible. As you said, a whole lot more than it was before Obamacare. Yeah, yes, per month. I felt like that was the case. Just checking. So Thompson Greenwood's mad because Vance broke the tie and voted for the big, beautiful bill. He no fan of it, of course.
Although he's yet to provide us with anything that would pass with 50 votes.
Yeah, because there is nothing. You're talking about with 60 votes, right?
No,
what
50 votes. We had to have 50 votes
to
pass the big, beautiful bill.
I got you.
But the big, beautiful bill was reconciliation.
Right.
In order to pass anything that's not reconciliation, you got to have 60 votes.
Correct. And I know we repeat that a lot, but it needs to be repeated because that's probably one of the least understood realities of the rules in passing legislation. Because I know a lot of people get all bent out of shape about why don't the Republicans do this and this and this. They got control. You really don't when you got 50. In this case, 53. We're stepping aside for a break. It's time for Fox News, SuperTalk News. Aaron Rice is next.
Welcome to the show that challenges you to think deeply and look beyond political posturing. You're listening to Middays with Gerard Gibert here on SuperTalk, Mississippi.
Welcome back, everyone. It's Middays. We are live from the Element Wealth studio. This is hour 3, the afternoon portion of the program. My wife, I was just passing this on in the studio here. My wife just sent me a text, said Jimmy Swaggart passed away. How old was he, Rhino?
90.
90 years old, man. Seemed like just yesterday he was on television with that fake crying and the lip quivering. I have sinned against you. Remember that?
88.
Was it 1988?
Yep.
Okay. Wow, man. Well, we're pleased to welcome Aaron Rice, founder and CEO of American Dream Legal. Aaron, it's been a while. Thanks for coming in.
It has been a while. Good to see you, Gerard. Thanks for having me.
So you got this new venture going on. Tell us about that.
Absolutely. Yeah. So it's, like you said, it's named American Dream Legal. And basically what we do is defend the American dream in court. And so, really, it's interesting to me because the American dream is something that everybody used to agree on and believe in. But these days, a lot of people, I was researching this when we were naming it. I mean, if you look at online, 50% more people search for the American dream is dead than search for the American dream is alive. You've got books on the New York Times bestsellers list that claim the dream is a sham, and I saw just the other day that even Captain America, of all people, if you want to call him a person, came out in a comic book a couple years ago and said that the American dream was never really existed. And so there's this skepticism. Yeah, and so obviously I disagree strongly with that. I think there's a lot of confusion on what the dream actually is. But regardless, the positive side of it is that regular Americans aren't buying all that. It's 70% of Americans still believe the dream is real, and we do too. And so I don't think the dream is dead. We don't think the dream is dead, but we do think it's under attack and it has to be defended. And so that's what we do is represent everyday, Americans when their rights are being trampled and things are happening that are keeping them from pursuing the American dream. And we represent them in court. And if we win, obviously it's great for them, but it also sets a precedent that protects the rights of everyone.
Okay. All right. Well, that's pretty cool. So Do you have any cases that you're working on right now?
Yeah, absolutely. You may have seen just the other day we filed an appeal, and this actually, as you know, I've been doing this kind of legal work for years now, and so I was representing this group prior to the formation of American Dream, and now representing them at American Dream Legal. But we just filed an appeal for some pro-life doctors, and it's really an interesting situation. So what you have in Mississippi right now is, as everyone knows, once Roe v. Wade was overturned, we had a trigger law that went into effect in Mississippi that's declared that elective abortion in Mississippi was illegal. What a lot of people don't know is we also have a Mississippi Supreme Court opinion from 1998 that says elective abortion is a constitutional right in Mississippi under the Mississippi Constitution, not the U.S. Constitution. And so that's not affected by, the Dobbs decision. And so, a lot of people are actually kind of just willing to ignore that real direct conflict in the law there. But for our clients, they don't have the luxury of doing that. So their situation is that, they're pro-life doctors. They don't want to perform abortions or refer patients to have an abortion. But their board certification authority, which is this national organization, basically requires doctors who live in states where abortion is legal, even if they have, conscience objections to it, it basically requires them to refer patients. So even if you're not going to perform the abortion, you have to bare minimum, refer the patient to someone else who will. And if you don't do that, it could jeopardize your board certification. And so for our physicians, they don't really have the luxury of just pretending like or ignoring the fact that Mississippi law is very unclear right now. And so we filed an appeal in that case, and what we're asking the Mississippi Supreme Court directly to clarify what the law is in Mississippi. Is elective abortion a crime or a constitutional right? Two totally different things. And of course, our position is that the Mississippi Constitution never protected the right to abortion. That Mississippi Supreme Court opinion from 1998 was wrongly decided, just like the Roe v. Wade case was at the U.S. Supreme Court. And so, we're seeking to do here on the state level essentially what was done on the national level with Dobbs, which is, really only fitting that we should do that and have that happen here because, as you know, it was a Mississippi law that was challenged all the way up to the U.S. Supreme Court in the Dobbs case and wound up overturning Roe. So it really only makes sense that here in Mississippi we go ahead and put an end to our state courts doing the same thing and having these precedents that say, basically impose abortion policy by judicial fiat instead of letting our policymakers do it.
I've seen reports, Aaron, of physicians and healthcare providers in Texas, which also has very restrictive abortion laws, where they're concerned about even providing basic medical care to pregnant women on the grounds that they may face some sort of legal consequences from the state, right?
Yeah, and what's interesting about those two, I think that I mentioned earlier this board certification authority for OBGYNs. And I honestly think a lot of that confusion that you hear about, there's the confusion we have in Mississippi, which is different, which is fundamentally what is the law? Is abortion a crime or a constitutional right? It's just bare basics here. But when you get past that and you have physicians talking about, well, I don't know if I can, treat this patient or if this will count as, as a crime, if their life is in danger, what does that mean and all of that? I actually think a lot of that confusion stems from these same national organizations that I've mentioned that are putting pressure on our clients, these pro-life physicians. And essentially what I mean by that is that it's really kind of their job to educate, these OBGYNs around the nation about, what the laws are, what they mean, and all of that. And
they really new territory.
Exactly. It is. And so, but to make it worse, these national groups who are very, pro-abortion, they kind of refuse to help with that. And so you have physicians who may have those questions, like you said, and there may be a very clear answer to that question that could be, their board certification authority and their kind of national physician group could be helping them with that. And instead they would rather not help with that and keep that confusion around so that they can, use it as something to blame on these, abortion bans and say, look at all the confusion they create. And it's, you go, well, in any other situation, you would be helping clarify that confusion, but you won't do it here.
Yeah. Got it. Well, Interesting for sure how this is maybe sort of opened up lots of different legal issues as a result, right?
It has, absolutely. There's, you hear it referred to a lot of times as the post-Dobbs world. And just like anything, when you have a sea change in the law that, Dobbs, changed 49 years of U.S. Supreme Court precedent. And, there's been a lot of things that have been, built around that. And so once that is wiped away, you certainly do have – I remember, for example, in the aftermath of the Dobbs decision, there would be a lot of questions surrounding, can states that do outlaw it, do they have authority for people that travel beyond their borders? Or, can the federal government pass, a federal statute that prohibits abortion in all the states? And as you and I have talked about before, we are both in favor of, leaving this at the state level. That's one of the great things about federalism is letting the states decide it. And I think that was part of the Dobbs decision was, recognizing, the benefits of federalism. And there's certainly a lot of questions that pop up.
Okay. So the name of the organization, American Dream Legal. Yep. So where do you see kind of the future of your cases? Do they relate to this American Dream?
Yeah, absolutely. So we kind of put them into three different buckets. And it's in my mind, the things that are the main components of the American Dream that I mentioned earlier. And so one of those is the pursuit of happiness is what we call it. And that's basically, your freedom to choose to chase your dreams. And usually that's going to involve, and primarily that involves, the occupation of your choice and being able to do that. That's really the heart of the American Dream is to build a better life for yourself through hard work. And so, y'all talked about certificate of need with your past guests briefly. Mm-hmm. We're representing a client right now who's got a challenge to some of Mississippi's certificate of need laws. But there's a lot of instances outside of CON, with occupational licensing or all kind of other places where you basically got crony capitalism is what you've got. It should be very easy to go open a business. You shouldn't have to curry favor with regulators to do it. But instead, entrenched incumbents have used connections in the government to shut competition out. And so we're very opposed to that. We think that, undermines the American dream. And so we represent, people who want to challenge things like that happen to them. Another component of the dream is equality of opportunity. And so, it used to be that civil rights leaders fought for all of us to be treated equally before the law. But as you're very aware, today with this kind of obsession with group identity, today you've got actual governments that are discriminating against people and denying them opportunities that the American dream should leave open to them based on, immutable characteristics like their race or their sex or other labels that are put out there. And so we want to, put a stop to that as well because we think that undermines the American dream. And lastly, kind of just the bedrock of the American dream is individual liberty. And that's, your freedoms that are essential to American life, recognized in our Constitution, and a lot of them are under attack, whether that's, the right to free speech or self-defense or parental rights, all kind of things like that. And so we want to defend people's individual rights as well.
Hang around if you can. We'll keep
absolutely.
Talking. We got Aaron Rice, founder and CEO of American Dream Legal, in the Element Wealth studio.
Hey, this is Bob.
It's so awesome! Middays with Gerard Gibert.
Come on, let's get on with the show!
On SuperTalk, Mississippi.
We are back with you in the Element Wealth studio. Aaron Rice, founder, CEO of American Dream Legal. So, Aaron, this just sounds like kind of an extension of a lot of the work you were doing in the past, right?
Absolutely. So, I mentioned earlier, I mean, as you know, I've been doing this this kind of constitutional litigation since 2018. And so I was doing that at the Mississippi Center for Public Policy and, saw an opportunity here and a need here to go out and start my own public interest law firm that does that. And, really, it's nothing against MCPP or anything. There's certain things that, when you're doing it with a public policy organization, obviously it needs to be, the cases you're doing need to be very closely tied to the policy goals of the organization. And kind of, there's a lot of areas for legal reform that are needed that don't necessarily tie to an immediate public policy benefit. So, for example, you probably remember a year or two ago, the U.S. Supreme Court had a big case where they overruled something called Chevron deference, if you remember that. Yeah. And so that's an example of something where, legal reform is needed. That was a terrible precedent and jurisprudence of the court to do that. Basically, for the listeners, it meant that, if you challenged a government agency in court that was doing something and you said, look, the law does not allow the agency to do that, and the agency said, yes, this law passed by Congress does allow us to do it, then when it got to the courts would defer to the agency. And, that's fundamentally wrong because it's fundamentally the job of the courts to interpret the law and say what the law means. But for years and years, the Supreme Court had this doctrine that said that the courts will defer to, government agencies and their interpretation of what the law allows them to do. And so obviously that spawns all kind of public policy problems. But, if you're working on that, that's not tied to an immediate public policy issue, that might be, a priority of a think tank or something like that. Yeah. And so, there's a lot of opportunities like that where there's broader legal reform that needs to occur. And so, this is really, like you said, an extension of work that I have personally been doing for years, but on a broader scale, and I think that it will kind of widen our opportunities for things we can do.
Something that you and I have both advocated for is just some common sense reforms to occupational licensing, which are overbearing in our state. For a red state, it seems like we lean in the wrong direction on that one.
Absolutely, and that's it's interesting that you say that because that's one of the most interesting to me is that we are a very red state. But when you look at issues like occupational licensing, in Mississippi, I mean, I don't want to necessarily say we're one of the worst, but we're certainly not one of the best. And I think it's there's a lot of issues like that where the interest of, I mentioned earlier, entrenched players are so pronounced and they will push so hard to get what they want at the legislature, whether what they want is really constitutional or not, that, it's one of those things where despite being, a red state where you would expect us to have a much higher regard for individual liberty and the American dream like we've been talking about, you nevertheless, when you go through the Mississippi Code, find all these examples of carve-outs or benefits and favors. Protectionism.
Cronied up through the years.
Exactly. Absolutely cronied up. And so there's a lot of that. And, I have personally done a lot of cases like that. We had an eyebrow threader, Deepa Bhattarai was her name, that I represented, and got her to be able to open up, her, and she's doing great, by the way, today. I mean, she, was just trying to, do one salon at the time that did this eyebrow threading, and, she won her case, and today, she's got multiple locations opened up throughout Mississippi. I want to say it's 5 and counting. And she inked a deal with Walmart where she's eligible to open salons in, actual Walmart locations, which I think she has already done or is in the process of doing. And so she is just, thriving, living her American dream, which again, just like you said, that's exactly what we want. Mm-hmm. And I've done that again. I've had cases representing, all kind of people, whether they were in telemedicine or other cosmetology related industries, all kind of things, where you had these anti-competitive laws, and I've challenged those and will continue to challenge those at American Dream Legal.
Well, and there's some other areas of protectionism as well that unfortunately exist in our state, and I've been known to say in the past that we're all about free markets in Mississippi, except when it comes to education and health care and occupational licensing and vehicle sales and sports betting. Other than that, we're all about it, right?
And where you see that a lot, too, is on the individual level. You'll see a lot of people that are, I'm all for, individual liberty or free markets, except for when it comes to my business. And there's always a special reason. There's always a special reason why, it doesn't really work in my industry.
Everybody's got a sacred cow.
Yeah, absolutely.
And that's how we arguably ended up in $37 trillion of debt.
That's right.
Well, can't cut that, right?
Yeah.
But that's okay.
I'm in general, I'm in favor of all of this. We need to cut spending, but not this one that helps me.
Well, so are you going to be working with lawmakers in any regard to maybe try to shape some legislation?
It's interesting. So we actually did get approval, and that's one of the things that has been going on behind the scenes in forming American Dream Legal. It's a major task to do that, and so we have approval from the IRS to operate as a 501c3, and we actually did go ahead and get approval to do that. What you're saying, to essentially lobby the legislature so that when there's issues that we're working on in the courts, but we think, hey, this could be handled through legislation that would preempt a lot of these problems or things like that. And so we have the approval to do it. We are not going to be doing it in the immediate future. And I say that just because, as you know, we're a startup and we're getting rolling here, and so the main priority is definitely litigation right now, and that's what we're completely focused on. And as you know too, we've got thankfully some great groups here in Mississippi, like Empower and the Mississippi Center for Public Policy and other groups who are doing that kind of work. And so I think for the time being, what you'll see us do more of is work with those groups, and they may see a problem that really only can be fixed with a litigation solution, and they may highlight that problem to us and see if we can help with it, or they may refer a client to us. And then conversely, we may see problems through our litigation that really need a legislative solution, and we may go talk to them and say, hey, this is something we're seeing. Do y'all think y'all could sponsor and push some legislation on this? But again, down the road, I think it'd be the same thing as with founding American Dream Legal. If we see things that are kind of purely legal reform that's needed, but needed, through the legislature, and that we're uniquely positioned to be the voice on, then I could see us expanding down the road and doing a little bit of that.
You talked about the Chevron deference was absolutely a landmark decision by the Supreme Court. It had been going on too long. It just feels like, Aaron, that we're more at risk of our rights being violated, and certainly contradicting or conflicting with federalism, with policies and regulations issued by non-elected bureaucrats in the agencies in the federal government than we are the people who get elected to make the laws.
Absolutely, and that you're exactly right about that. It's a huge issue, and it really comes back to these kind of fundamental constitutional issues that we work on. But one of those is the separation of powers, and the way this is supposed to work is that Congress is supposed to legislate and the executive is supposed to enforce and all of that. But as you know, what we've had over decades and decades now is the whether it's state legislatures or Congress, doing less of that and farming more and more authority out to these bureaucrats, and just saying, they'll kind of have a bill that says, we need to tackle this problem, we create this agency, y'all go handle it.
Yeah.
And so you've delegated a lot of authority to these, nameless, faceless bureaucrats who, are not held accountable by the people because they don't have to run for election. And if what they're doing is unpopular, there's no mechanism to really get them out of office or stop them from doing it.
Right.
And that's, again, where American Dream Legal comes in, is because your average American really doesn't have any levers to pull there and really anything they can do. That's where we can come in and say, well, maybe you can't vote these people out of office, or maybe, other things like that you could normally do, but we'll represent you for free, and we'll try to put a stop to it.
Well, I just feel like, honestly, and so I'm glad your organization recognizes this and is focused on this, that it seems like we're in full-time mode of having to stand in the gap
Absolutely.
to prevent the federal overreach down to the state and individual level.
Absolutely. And you know, I do think, again, it goes back to what we were talking about, Congress just farming all this out. And then you also have, you know, executives in either party who see that gap and say, well, I'm going to fill it and I'm going to do whatever I want.
Yeah. Aaron, appreciate you coming on.
Yeah,
Good
absolutely.
luck. Yeah,
thanks so much,
like
Gerard.
a great deal. Appreciate it.
Yep.
Aaron Rice, founder and CEO of American Dream Legal, has been our guest in the Element Well studio. We're coming right back.
From the Seabrook.
Interrupt this program.
Gerard Gibert.
Here we go. This is huge news. Huge news. Huge. You need to listen to this.
Middays with Gerard. SuperTalk, Mississippi.
No idea where they came up with a great name for that band. Johnny Hates Jazz. Another one of those quintessential 80s tunes, right? With
it
a great
actually
video.
comes from a real person.
Okay.
Clark Datchler's brother-in-law, named Johnny,
all right,
who vociferously hates jazz.
That's so cool. Johnny Hates Jazz. And somebody just decided, oh, that'd be a great name for a band. Shattered Dreams, the name of the tune. It's a great tune, by the way. We're back with you in the Element Well studio. Half an hour left on this Tuesday as we're in the midst of July 4th week. July 4th, when we celebrate our independence, occurs this Friday. We'll have the best of airing on that day. I'm still going to be working. I'm going up to Old Waverly, played a little golf, and am scheduled to be on Newsmax during the golf round at 10:45 Central Time, 11:45 Eastern Time. I should be on about hole 9 at that point, I figured. And I was sharing with Rhino yesterday, I broke down and bought me a little attachment to put my phone in on my golf cart, and it's one of those kind of articulating mount sort of deal, so I can adjust it and get it just right. And I told him, "Gosh, I'm sorry, I'm off that day. I'm playing in a golf event with my son. What do you think about me doing the show, doing the interview, I should say, from the golf course?" And they loved it. They came back. It's July 4th, of course, and I will have my July 4th attire on, celebrating the nation's independence. And guys, if you've ever been to Old Waverly Club, Mr. Bryan, of course, the founder, and Mr. Harold, big fans of this country, as all good patriotic Americans are. And there is a gigantic American flag that hangs from an oak tree, a huge oak tree, between the clubhouse and the lake there at Old Waverly. And so I'm hoping to get positioned with the flag in the background. And they have always been supporters of this great country, and they love it so, the way so many of us do. And by the way, have you seen some polls recently that show that upwards of 56% of Americans are happy about their country? Wasn't too long ago, we were up underwater, upside down. Of course, during the Biden administration, I could understand the dejection. However, you also notice that overwhelmingly of Republicans, like 80%, have a positive viewpoint of the country. What's changed, that hasn't changed, honestly. It's up a little bit, but what's changed is now many Democrats do. That's boosted the numbers from a favorability perspective. So that's good news in that respect. as we approach July 4th. So we told you about the new laws going into effect in Mississippi today. We got the big, beautiful bill that has passed the Senate, and it now is headed to conference with the House. You know, I'll just say this. Regardless of what you think about the president, I don't think you can really deny the fact that it's been a pretty good run the last few weeks, has it not, Rhino, for this president? And you got to be amazed at how much not only how much he's able to accomplish, but just the wide spectrum, the wide range of issues. Because you think about how many things you got to deal with as a president, as an administration, and no doubt you're surrounded by a whole bunch of experts across those various subjects. But with all the stuff he's been doing on the foreign stage, remember the trip not too long ago to the Middle East where he was cutting deals while he was there with Qatar and Saudi Arabia and UAE. We had American companies agreeing to invest in projects in those countries agreeing to invest hundreds of billions in this country. He's brokered peace deals. The one in Africa, how long has that squabble been going on? 50 years? Yeah. So, been brokering peace deals. And then, of course, not too long ago, the decimation of Iran's nuclear capability, despite what some leakers, no doubt, aggrieved leakers in the Pentagon that are just mad and don't want anything good to come of this presidency. They're more about rooting more for failure of this president than they are what's in the best interest of not only the country, but certainly in this case, the world. So you got that going on. Looks like we've got some degree of stopping of the carnage between Israel and certainly Iran as a result of that. So that's good news. So you got good stuff going on the global stage. I'm not a big fan of tariffs, but it certainly has gotten the attention of countries who have had unfair trade policies against this country, and they're straightening those out. You saw Canada. How about this one, Rhino? We didn't even talk about this yesterday. I know you're aware. They have pivoted on their taxation of digital services. This is something Europe loves to do as well. And the president's right. This is crazy. It's unfair. And I'll take it a step further than that. It's jealousy. Because those countries don't produce squat, relatively speaking, in terms of technology, information technology, and digital services that the world uses. That comes from this country. And so the EU and Canada, well, since we don't have any, we're just going to tax the snot out of yours. I mean, I really do think that's what's going on here. So Canada, you saw this, said, okay, no more. And the president thanked them and honestly praised them, said, well, you made the right decision here. So that's good. And then you got the big, beautiful bill. We're also seeing that Saudi Arabia and the OPEC nations, looks like they're going to open up the spigots and generate more oil for us. You're seeing massive investments in data centers and artificial intelligence. And now, this morning we shared with you this, I think, largest ever investment in an energy project described as hypergrid going on out in Texas, in the Amarillo, Texas area. Man, this is just great. By the way, my email, of course, my notifications are filling up with all the various news outlets that are, you're seeing it too, that are reporting on the passing the big, beautiful bill. So, man, we're off to the races. We got the markets in green territory, the Dow up 452. So it's you can't deny it's been a good couple of weeks when you think about making massive progress on the economic front here domestically, while at the same time, I hope, ridding the world of the nuclear menace of Iran and the radical Islamists, the Ayatollah, honestly, that are suppressing their own people. Now, did you see this video that's rather disgusting of young Iranian women dressed in their burqas with their babies, like offering them to the state to sacrifice as martyrs to go fight us in Israel? What kind of sick cult is this? These aren't peace-loving people. Is there anything more disgusting than, and you've seen it, they're chanting in this meeting. I'm not sure if the folks have. And they're holding their baby up, like towards the Ayatollah. Huh, take my baby. Baby. I can't emphasize it enough. How sick is that? How could you even be fit to be a mother when you're offering your own flesh and blood child as a martyr for the stupidest of causes? Good God, man, what's going on? That kept me up. I got to tell you. I anguished over that. I just couldn't believe that what I was seeing. And then you got this lunatic in the UK, from the river to the sea, chant crap. You've seen that garbage as well going on?
Oh, yeah, they had the whole Glastonbury Festival, and if you look at the crowd, it might as well have been a Palestinian protest.
Unbelievable. It's in the UK.
Sea of Palestinian flags.
In jolly old England. I just couldn't believe it. Yeah, Sea of Palestine. No Union Jack flags anywhere around, just the Palestinian flag. This is England. You did it to yourself, guys. I don't know what else to tell you. We're stopping that crap. I didn't even talk about that, how the president closed the border. That's like old news now. We're stepping aside for a break. Final segment coming up next.
Hey, this is Bob, and if you're like
Gerard Gibert. Going beyond the headlines, breaking down the stories that matter to Mississippi. Middays with Gerard on SuperTalk Mississippi.
Johnny was a schoolboy when he heard his first Beatles song. Love me do, I think it was, but from there it didn't take him long. Got himself a guitar, used to play every night. Now he's in a rock and roll outfit and everything's alright. Don't you know?
Welcome back, everyone. It's Middays, SuperTalk Mississippi. Mick Ralphs, the guitarist and co-founder of the band, performing that tune there, Bad Company. He died recently at the age of 81. He also co-founded Mott the Hoople. You familiar with that one? Mott the Hoople?
Yeah. All the young dudes.
Yeah, all the young dudes. Did they do anything else but that? I'm not sure I could think of any two. What a great band name, Mott the Hoople. So Mick Ralphs, Bad Company. I remember, Rhino, when their first album was introduced, I think I was in high school, if I'm not mistaken. And, man, we all had it. It was awesome. So, back with you in the Element Well studio, of course. Ricky in Aberdeen says, where are all the whiners of Medicaid expansion at now? Greg and Newton saying this, I'm not happy with a higher gas tax with them getting the money there, the biggest waste of taxpayer money there is. Executive Director Brad White would argue with you on that one, Greg. And again, I'm a just remind you, keep in mind that the vast majority of the funding to the Department of Transportation is from the federal government, and then additionally, most of the work done by the Department of Transportation on the state's infrastructure is performed by third-party construction companies. That by far consumes more of the dollar than the actual staff internally does.
I think you mentioned that in the message right before that.
Oh, yeah, I sure did. Yep. Yeah, it's contractors. So if you look at who are winning these contracts, it's primarily 4 road builders that win the lion's share of them. And I'm not sure why the number seems to have shrunk. I don't know what's going on there. On the C Spire text line, can y'all line up with an interview with the chairman of the Senate committee that won't bring mobile sports betting to a vote? We just did. Was on that last week. That's Senator David Blunt. And he expressed his concerns about mobile sports betting. He's been fairly consistent. He's concerned about how that would affect the casino gaming industry. Also, as I recall, Rhino, he's concerned about how that might just expand the number of people who are spending money for this purpose. Didn't he say something about that as an objection? I know Senator Hobb Bryan, he expressed his opposition to the lottery on that basis. And in fact, when I was going through my Senate hearing and approval process, he shared that viewpoint with me. And I, of course, had to remind him, Senator, I'm just here to build this thing out as a member of the board. You need to talk to the other people in this room that passed this law. They're the ones that made this, not me. Well, what would Thomas in Greenville? Why would he be mad? How did he think Vance was going to vote? Ben from Madison says, we're way ahead of China on data centers, but they are way ahead of us on the construction of new reactors. We have to find ways to make permitting through the NRC easier from top to bottom. I agree with you, Ben, but we also have to have more interest in investing in nuclear. And it could be because of the onerous permitting process is a big part of that. And also a government that hasn't been too favorable in the past. I think now
just think about this. If it costs anywhere from $6 to $10 billion to stand up a nuclear power plant.
Yeah.
And you have to start investing those billions of dollars on day one. And with power plants, you generally don't start seeing profit. You don't have it paid off for decades of time, but you can't even start making any money for years upon years upon years while you jump through all the different hoops the government's throwing at you.
Yeah, that's absolutely true. And it's the same thing with respect to the lack of investment in new refining capacity in this country as well. Because, again, it's that faith, confidence, and certainty. You don't have a lot of that, and you're talking about a long-term investment. It's like I need faith, confidence, and certainty if I'm going to invest tens of billions of dollars in a refinery. I need that for like 15, 20 years, not for the next couple, like during the Trump administration where, they're friendly to fossil fuels. And we just don't have that coming from the left at this country. The ladies on The View this morning said President Trump has suspended the First Amendment. When did that happen? Yeah, they're crazy. You also saw that Whoopi Goldberg said that health insurance, if you pay health insurance and you don't use it, they ought to refund you all the money you didn't pay, which would make the cost of health insurance go up like quadruple. She doesn't understand the basics.
There's a laundry list of things she doesn't understand.
We are out of here today. Thanks so much for joining us. Back again tomorrow. Until then, stay safe and God bless everyone.
A SuperTalk Mississippi media production.